This is my camera. Let me know when you're ready.
This is mine.
Call me. One.
Hey, it's Dr. Wilton Triggs here. Welcome to Triggs Table Talk, where I bring you some of the dopest individuals on the face of the planet that specialize in everything. And we're not talking about healthcare, we're talking about entertainment, sports. And so today I'm honored to have Dr. Jeff Rocker here, who also is known to be a celebrity therapist. And so without further ado, I would like to introduce Dr. Rocker. Rocker, thank you for being here, brother.
Hey, thanks for having me on the show.
Hey, man, it's funny. We met through a mutual friend, but we still have. This is our first time actually like linking up.
That's
and
crazy.
Kicking it. So I apologize. I know you busy. I'm busy, but I'm glad you were able to take the time, like on a busy Thursday, to get down here and discuss your expertise and where you're from and all that to the people, man.
Of course, they need to hear it. So I'm glad to be here.
Hey, man, appreciate it. So with that being said, man, tell us a little bit about your background, like how you got started and like what brought you here to South Florida and, starting your practice or whatnot?
Well, first of all, I was born and raised in County Dade now. So,
okay.
North Miami
so
Beach.
you're a Florida boy, legit?
All day, we
okay.
outside, we
right.
here, you feel me?
Yeah.
But most people know about the beautiful parts about Miami.
Yeah.
But they don't know about the rougher parts.
Right.
And I grew up in some of the rougher parts, in the NMB city.
Okay.
And in those parts, there's a lot of gang violence and domestic violence,
right.
drug use. So there's a lot of stuff going on, and a lot of people don't even know how to deal with these things.
Right.
One of those people, me included.
Yeah.
So my first encounter with mental health was that one day, by the way, I just played ball, by the way.
Yeah.
Played ball at NMB high school, senior high school. I'm a Charger for life.
All right, for sure.
All day.
What's NMB stand for again?
North Miami Beach.
North Miami Beach, okay. I'm not from here, so you got sometimes I got to explain a little bit.
I got you. So, of course, I feel like I was a man, homie. You can't tell me nothing back then, you feel me? But back in the day, I was doing my thing, and I got caught up with the wrong crowd.
Mm-hmm.
And I was skipping school, I was skipping classes.
How old were you about that time?
About like 16 years old, man.
Right.
So, at one point, as you know, you need a certain GPA to play.
Yeah.
So one day, the coach called me into the office. He's like, hey, you know what, Jeff? Sorry to tell you, I got to cut you from the basketball team.
I was like, bro, I know you playing.
Oh,
right?
man,
I know
listen.
you was hurt.
I was like, I couldn't believe what he was saying.
Right.
But when that's how I lost my mind,
Yeah.
I lost it. I got depressed. I lost weight.
Yeah.
I went back to my parents. And by the way, I'm Haitian. I'm a Zoe for life. You feel me?
Yeah.
So if you know anything about Haitian culture, is that we don't believe in mental health.
Yeah.
So for me, when I was going through it, they didn't even know how to help me. They were just like, yo, figure it out, man up, man, tough it out.
Pray it out.
Go to the priest or the pastor to fix this problem. But that just could not help me.
Right.
Until one day I had a guidance counselor. I said, you know what? I think you're going through depression. I think this is what you need to do to get some help. And since then, I realized, you know what? More people like myself need to hear people like us for us talk about mental health.
That's crazy because like even in the Black community period, like mental health it's gotten better as far as like the stigma, but like it was like really taboo. Like oh, you crazy? Why you talking to a therapist? Why are you talking to this, that, and the other? And now I think because of social media and it's becoming more mainstream, almost kind of like plastic surgery, like people talk about it a lot more.
Yeah.
Even though people be misusing a lot of the terms, like I can't tell you how many times I've heard narcissist and boundaries and stuff like that. But and the crazy part is you got introduced to it at a young age.
Yes.
Like for me, I maybe late 20s, you know what I'm saying, before I even considered mental health or, even saw a therapist or anything like that. So that's amazing. And how do you think that helped you, talking with a professional early on versus had it been another 5 to 10 years before you like got introduced to mental health? Do you think it would have changed you a lot, or you think you would have continued to spiral?
I would probably consider spiral, most definitely, because I just didn't know how to solve it.
Right.
Now, eventually, I probably would have got on track eventually, but I would have probably failed a grade, been held back, probably never got back on the basketball team. So a lot of things would have happened in that short amount of time that would have been life-changing for me.
Oh, man. So this definitely was a pivotal point. So, you found someone to talk to. What were some of the strategies or things they help you develop to like basically get back on track, get back to being you, get back to being Jeff?
They told me about journaling. I was like, man, I hate writing. So why the hell you asked me to journal?
Right.
So I was kind of resistant in the beginning, like most kids in the beginning.
Yeah.
But once I realized that there was a need for it and I got to do something different to get back on track, I said, you know what, let me give it a shot. So I started journaling maybe two to three times a week, which you need to do it every 7 days or every day. But eventually I started doing it every day. And I started seeing the difference where I was able to write down my thoughts and my feelings and process those emotions every day.
I've journaled before, and this was probably like just this past winter. And I was like, let me try this. And I was saying like you, I was like, man, what's this doing? I don't even know how this works. But it really does like make you feel some type, makes you feel better. It's like you get these thoughts out, like you having a bad day, you just start writing, and no matter what, just start writing. And then you just like, oh man, I feel better. I feel good. It's a weird feeling. I don't really know how it works, like from a psychological standpoint or from a like a biophysical standpoint, but it's amazing.
I mean, honestly, it's really simple in the sense that it's just your outlet to express yourself.
Gotcha.
As Black males, we're not used to doing that.
Right.
We're not actually. We feel like we're not allowed to do that.
Right.
So when someone gives you a tool to journal or verbalize how you feel, that's something that we're not used to. We don't know how to even address that.
Right.
So that's our outlet. I think most men need to do something like that, whether it be journaling or express yourself or even identify how you feel.
Right.
That goes a long way because a lot of times we say stuff like I'm angry, I'm sad, but really you're disappointed.
Yeah.
Using those more deeper emotions that you're going through, be able to identify it. That's what emotional intelligence play a huge factor into that.
Man, that's right, man. That's crazy.
All right, so you tell it.
Like it's funny. It's funny you say that because there are times where it's like someone asks you like, so how are you feeling? Like I have very like intentional friends.
Everybody says I'm okay.
Yeah, they either say I'm okay or me. I was like, man, I don't know. I just feel like I'm in a funk or something. Like I can't really describe it. I don't think I'm happy. I don't think I'm sad, but I just feel some type of way. And so like, yeah, like when you say like you learn how to identify those emotions and then I guess from identifying them, you can actually like solve them, the different tools and stuff like that. So when did you really start? So you in high school, saying what was the next step like from high school, like, being cut from the basketball team and then starting to get help. So what was the next part of the journey?
Life got better. Thank God.
Yeah.
But I had to go to a realization that I'm not going to the NBA.
Okay. I'm sorry.
When I said that shit hurt, I ain't gonna lie. I thought it was the next Kobe, man.
Yeah, the hoop dreams, bro.
I'm telling you, like most inner city Black kids, sports was my way out.
Right.
So being a doctor, being a therapist, being in the field of mental health, that was never in the cards for me. Never thought I would be in this field. Even today, I'm like, damn, I'm still here.
Yeah. I'm really doing this.
I'm really doing this. You feel me? So once I realized I couldn't make it to the NBA, I had to pivot.
Yeah.
So then I said, damn, what do I want to do for my life? I was like, you know what? I kind of like what my guidance counselor did. I like the way she helped me.
Yeah.
So let me go into this field.
And also, you knew early on.
Yes, thank God, because a lot of people go to college without knowing, or they switch it out.
Now I was engineering, and now I'm a plastic surgeon. It's similar, but it's definitely different. So that's crazy, like how you were able to pick that up early on, and actually stuck with it. Because some people be like, "Oh, I like what this doctor did. I'm gonna be a pediatrician," and next thing you know, they're an architect.
Listen, it wasn't easy to stick with it, bro. Because I'm thinking like most people at the time, okay, all I gotta do is 4 years and I'm done.
Yeah.
Shit.
That's when the real work started to kick in. Yeah.
Master's, doctor, I realized there's a lot of work to be done. There's a lot of degrees that need to be attained, certifications and licenses. So
where did you get your college degree at?
So I went to the great Bethune-Cookman University.
Okay, gotcha.
HBC grad.
All right, perfect. I love it, man.
And then I went to Nova Southeastern.
Okay, perfect. Yeah, I went to Meharry Medical College, another HBCU up in Nashville, Tennessee, man. So how was your experience at Bethune-Cookman coming from South Florida?
Oh, man, listen, never a dull moment. Never a dull moment.
You loved it. The HBCU life is crazy, right? I tell
you. But it's funny because like I said, I'm born and raised in Miami, and I remember my first encounter just in life, the different cultures is that went up to Bethune because that was my first time seeing a Black American.
Yeah.
Down here, everybody's mixed with something.
That's right.
Everybody's mixed with something.
It's a different culture. And for me, my first time was in med school. So, I'm from Huntsville, Alabama. Most people I know are like, Black descendants of slavery, because usually when you use the term African American now, it's like those that are arriving from Africa now.
Yeah.
And so, like, when I went to Meharry, you would hear, like, these stereotypes, like how they would say, like, the true African-Americans kind of, like, look down on us that's already been here, because it's, like, all these cultural differences. I didn't even know that.
Yeah.
I ain't never had any African friends or anything like that. And so, and then, I moved down here, and then, you get exposed to, like, the Caribbean culture and things like that. It's totally different. Everybody tries to lump us together, but it's like, different, like, upbringings, for sure.
No, most definitely. Even just to be down here, from Miami. I remember going up to Daytona, by the way, that's where Bethune was at. They used to say, yo, Jeff, why you always mean mugging?
Yeah.
And I was like, what you mean? And I just had to reflect. I was like, you know what? I'm carrying the Miami in me
Yeah.
up north.
Yeah,
And that's
yeah.
up north because Daytona,
Yeah.
because Miami is Florida,
Yeah,
right?
yeah. Miami is its own thing.
It really
It's
is.
its
The
own thing.
behaviors, the approach, the mannerisms, everything is different from Miami than everything else.
So you just mean mugging boys up there.
I was. I was like, damn.
That's crazy.
You know, so I had to start smiling more. I had to do a little more chill. Look, I'm chill.
Look more approachable and stuff
I had
like that. Man, that's crazy. And so you did the Bethune-Cookman thing, and then you basically did you do Nova back down here in South Florida?
Actually, I did it in Tampa.
Okay. Oh, I didn't know they had one in Tampa.
Yeah, they have another location in Tampa.
I did not.
They got a lot of campuses.
I know they got a lot of campuses. I didn't know they had one in Tampa because I did my plastic surgery training in Tampa at USF, and I know we would get Nova students. They would rotate with us at the VA, but most of them were coming from down here, so I had no clue.
Actually, I did my certification for case management and social work at USF.
Oh man, that's dope, bro. That's super dope. So we during our deep dive, like researching you, learn about what you do. We heard about the hip hop therapy. Yeah, man. Can you explain and talk a little bit more on that?
So, well, first of all, how I even got to that point. Let me talk about that.
Definitely.
So as I'm moving along through Bethune, I learned a certain passion of mine.
Yeah,
music. Yeah, modeling. Yeah, acting. And of course, playing ball. So these are all things within the entertainment industry. Yeah. So I decided, how can I take these things and put into my profession? And that's what led me to the hip hop therapy. Because when I look at hip hop therapy, it's a way to engage with the youth and young adults in a way that's very different from any traditional way of therapy. Right. Which is taking music as a way to teach and educate about mental health issues and what people go through.
Gotcha.
So now they're singing, they're dancing, they're rapping, and they create their own songs about their understanding about mental health.
Oh, that's dope, man. Yes. And so how long ago did you get that idea and like basically almost brand it and start like implementing it into your practice?
2019.
Okay. Oh yeah, so it's still fairly new.
Yeah, it's still fairly new.
Good results coming through.
Oh yeah, I mean, I think where it got on the bigger stage is that one day, once again, I was doing my thing in hip hop therapy here in South Florida. I get a DM. Yeah. In that DM, it was Taraji P's representatives. Okay. So she said, "Yo, I love what you guys are doing down in South Florida. Why don't you come up to DC and present the hip hop therapy workshop?" Went out there, killed it, loved it, and ever since then I've been working with her every year to present the workshop to her, to the people that she serves.
So, man, that's crazy, man. So is that the segue how you started working with a lot more like affluent or like celebrity?
I would say so
at that point, just through
she gave me that reach out. She threw that alley, and I came in.
Yeah. Hey, I can lead you to water, but it's up to you to drink it. So you just took that and just ran with it. And so what's been some of like I'm sure that's probably like one of your like defining moments. What are some other moments that you've had? Working with the hip hop therapy, working with other celebrities that you like, oh man, I know I'm doing what I'm doing. Like I love what I'm doing. Like those moments. What are some of those big moments that you've had?
Ooh, it's quite a few. Being on Forbes, for different articles about mental health, but also seeing inspiring others. Seeing people say, "Hey, Jeff, I want to be just like you. I want to be a celebrity therapist. I want to reach this type of clientele." Right. For me, that's always been something I've been happy to see and continue to push forward because in our field, I don't know if you know much about mental health, is that we don't get paid. And traditionally, we don't get paid a lot. Right. So if you're gonna get paid, you got to be above and beyond. You got to do something different. Luckily, I found my difference maker and I went that route. But most people are not in that financial state where I'm at right now in the field of mental health.
And I think it's important to point out you weren't looking for clout. You weren't looking for those types of stuff. You were just doing your thing. You were implementing your passions into your career, and it just took off. People saw that, they recognized the good work you were doing, and then just exploded from there. And I think sometimes people try to rush into like the clout or the fame and things like that, but you were just like building your craft, and it just happened to catch fire. Yeah. And you just been running with it ever since. So I think that's really important.
And embracing who I am as a person.
Exactly.
I think that sometimes we feel like we have to change to societal standards. Right. No, I said, I'm going to have society adapt to my standards. Right. And do what I feel like is that they should learn and adopt and within the culture. Right. Because having a black male therapist that could talk the lingo and that could not always wear a suit, dress down, and have a good time, but also explain and educate you about mental health goes a long way.
Did you have any mentors in that space that look like you or talk like you at all?
Hell no. I wish, and I talk about this all the time, how important it is to have mentors, but unfortunately, I create my own lane. Yeah. And I realized, you know what? If I did, would it be things be different? Would it be the same? I have no idea. But I know that now, since I have the opportunity to give back, I want to be a mentor to a lot of people who's thinking about entering this field and working with this type of clientele.
So I know like not being able to have like a mentor or someone that looks like you or to kind of guide you through what you are expected to be like going through, being a young black male. I know, like, I guess it's great that you are within the mental health community because I know that can be lonely. That could be like,
Yeah.
deal with imposter syndrome. You could deal with like all these doubts and things like that. So how did you get through some of these feelings? Like, because basically is you.
Yeah.
Me, Jeff, going through this program. I don't have anybody really to look up to. All I know is I have this vision of what I want to do. So how'd you get through those hard
You
times or
know,
those rough times?
honestly, although I had no one directly I could look up to, I looked up to or I seen as a role model was Kobe Bryant and
Okay.
and the Mamba mentality.
Yeah.
You know, the pursuit of greatness despite your circumstances.
Hmm.
And for me, I was adopted that, and even to today, I don't care what I'm going through or what situation I'm in. I
Right.
adopt that and I apply it to everything I do in life.
Oh man, that's dope, man. That
So,
that's a great way of thinking about it. So within your field and even like
mhm.
with your training, have you ever came across like any situations like dealing with like males or females in terms of like plastic surgery or their appearance or anything like that? Have you ever had to deal with anything like to that sort of?
But yes, because I think before they go to you, they go to me.
Yeah,
Yeah, right.
yeah, yeah. Exactly. That's what I wanted to ask. I wanted to ask.
So a lot of the times they go into some stage of low self esteem,
Yeah.
and or depression, or
Hmm.
going. Sometimes they coincide with each other.
Yeah.
And one thing I try to do is make sure they're doing it for the right reasons.
Yeah.
Sometimes they're doing it for because they want to be that model that everybody wants them to be, and
Hmm.
it's not the right reasons.
No,
If
exactly.
it makes you happy, truly makes you happy, go ahead and do it. But don't do it because society tells you need to do it.
Right,
Mhm.
exactly. And so, how often are you running into those type of patients now?
Not very frequently.
Yeah. So, has it increased over time, or was it one of those times like, oh, a couple of years ago, that's all I was having, and now it's kind of dying off, or is this something that you think it's like kind of increasing with
Oh, it's
social
definitely
media?
increases, especially with the clientele I work with. So of course, I work
Yeah.
with celebrities. So
Right.
anybody in the public light always wants to fix and
Hmm.
tweak and do little things to improve their appearance because they're in the public eye.
Right. Right. Yeah, I just had to ask, man. I mean, you've kind of answered this. How you feel about plastic surgery. If you're doing it for the right reasons. Have you seen any differences with your patients that you talk to them prior to, and then they have the procedure? Have you noticed any differences, whether it's good or bad, from a psychological standpoint?
The self esteem does go up, but I
Okay.
realize it's temporarily.
See, I didn't know that. That's good. That's a
Yeah.
good point.
So that's why you see people go to a second round of surgery, a
Yeah.
third
Yeah.
round,
Hmm.
because yeah, the first several months, 6 months, I would say they feel happy, they're proud, and things start to shift. It just
Hmm.
that's because that's what the body does.
Right.
It
Right.
shifts
Yeah.
for whatever reason, bad eating habits or whatever the case may be.
Right.
And then once it starts shifting, now you go back to that stage of depression. That now you
Hmm.
start questioning who you are, how you look, and does
Right.
anybody like you?
Right.
You start to go to a deep, dark stage.
Right.
And now you start thinking about how can I go back into get
Mhm.
nip and tuck and get back to where it needs to be again. So that's why people go through a lot of different stages,
Right.
second round, third rounds, and fourth, and so forth.
Man, that's a good point. I didn't know that. That's a very good point. So how do you help them within that realm? They've already had plastic surgery. You see them. All right, we hitting the 8 month mark. I can see like you're not as happy as you were, or you starting to see the changes. What kind of therapies um or programs or anything do you start to kind of like count on to kind of help them bring them out of that?
Really, I just
To
help.
try to keep them from the scalpel
Yeah,
again.
yeah,
Yeah, yeah.
but still that's your moneymaker. So I'm
Yeah,
trying to
yeah,
take it with
yeah,
you.
I got you, I
So I gotta
got you.
be fair what I
Yeah,
say
yeah,
now.
yeah.
But I just help them prioritize stuff their life in the right way. Because right
Right.
now their priority at that point is their appearance.
Mhm.
That's over their kids.
Yeah,
That's over their career.
yeah.
That's over everything, their family and everything else. So rather than putting it at number one, let's put that at number three or number four,
Right,
and put other things that has more priority in their life. So I don't want to take that away. If you still want to look good, that's a fine.
right,
But let it be the end all be all for you
right.
to function in life.
That's good, man. I like that. I like that. God, man, I've learned a lot, man. Um, what factors would you consider that a person needs to have from a psychological standpoint that be considered in good mental health? Because we think about physical health. Oh, your blood pressure's good. You got a good pulse. What I'm saying, you're oxygenating well. Saying nothing's hurting on you. How can you identify somebody that comes to talk to you? Just, oh, I'm just coming in because I feel like I'm supposed to have a mental health checkup. how do you deem someone like, oh, you're in good mental health versus someone like, oh, we need to, have some further
I want
therapies?
to say any one of us is ever good because life changes so quickly.
Right.
But what you can say is that are you doing your daily check-ins with yourself?
Mm.
See, and one thing, and we don't do that very often.
What is the daily check-in?
Just reflecting and just saying, how am I doing?
Right.
Actually, so it's like that internal conversation that you're having. How am I doing? If I'm doing good, okay, how can I keep that going? If I'm not doing good, how can I change it? And most times now we could solve that on our own.
Right.
It's the moment that we can't do it by ourselves is when you need to go seek for professional help.
That's good, man. Damn, man, you dropping the gems tonight. I mean, I'll be quite honest. I've been transparent about my views on mental health, which are like if you can get your body checked up, you need to get your mental checked up.
Yes.
Especially in today's society, what all we're exposed to via social media, the news, and then just being a black man in America, like it's a lot. It's a lot,
Yeah.
and so I feel like you got to have some type of like, like, oh, are you okay? Like, talk to a professional just to make sure everything's clicking right in case you're seeing things all right,
And have a good support system too.
Exactly. Exactly. And I've been blessed and like I've always had good therapists. Shout out to Miss Pam, Miss Angela, and so, I see them like maybe once a week or once every couple of weeks and
It's good.
stay on task, man. Because it's a lot. It's a lot, especially as you like matriculate into your career, you go higher, or you have like more family issues, your parents getting older. It's a lot of stress. And so just finding healthy coping mechanisms.
As a matter of fact, I would go as far as to say every entrepreneur should have a therapist.
I agree.
Honestly,
Absolutely agree.
caller ID, boom.
Yeah.
Call you because what happens is that every entrepreneur they're spending majority of the time on their business.
Yeah.
And like most entrepreneurs, they neglect everything else.
Yeah.
They neglect self, they neglect relationships, and neglect family as well, or school or whatever the priorities they have in their life.
Right.
So because of that work-life balance is key in the beginning. Everybody believes that, oh no, in the beginning I gotta work 80 hours a week and go. No, you're killing yourself.
Right.
Rather than work 80 hours a week, do 40, work more efficient, and allocate more time to everything else in your life.
What population of your patients would you say is the most difficult to help or work with? Whether that be an entrepreneur or a certain type of celebrity or a model or your regular Joe Blow. Who would you say is like the hardest patient population to work with?
Definitely anybody in the public eye.
Okay.
Because they have a lot of yes men.
Oh yeah, that's right.
Every one of them have a yes man. Why? Because they benefit from being a yes man. I'm taking care of you. We're getting VIP tickets. We get courtside seats. So there's a reason why I'm a yes man because I benefit from being a yes man.
Right.
But that true friend who's telling you no, or you need to.
So how do they even wind up getting to you? Because it seems like that's a huge step for somebody that like, that's in a public eye that maybe even not take mental health as serious or like, oh, I don't need this. Like, how are they usually getting to you at that point? Do they just finally break down and be like, hey, I need to see someone? Or
unfortunately, nowadays, when people seek help, it's because they had a mental health breakdown.
Gotcha.
It's never because I'm just getting checked up. You hardly ever I want to check it up. Nah,
that's something bad.
If something had to happen to force them to get in therapy, whether it be something they reflected on, or maybe their spouse, but hey, you need to get some help, or something happened within in the media space where they're like, you know what, yeah, I got to get help because if not, it's gonna go in the wrong path.
Okay, man, man. Well, what I'm saying, this is the type of information you're gonna find on Triggs Table Talk. I mean, like, doing this deep dive, like intermingling plastic surgery and mental health and just mental health in general. So click like and subscribe. Check this out. Share this. Share your comments. This is great information. I hope you guys really enjoy. And we're back with Dr. Triggs here at Triggs Table Talk, and I'm rocking with Dr. Jeff Rocker, celebrity therapist. And now we're finna get into some tricky Triggs trivia, brother.
All right.
I don't have no money for you, anything like that. But we're gonna ask you a couple of questions.
Hopefully ain't too tricky now.
Yeah, I don't know. We got our last guest, but no, it's cool, man. Don't sweat it. So, just to kind of switch things back at the plastic surgery a little bit, if someone is changing their gender, do they need to see a psychologist or do they need to see any type of mental health therapist before making that change? What do you think?
I haven't had much engagement with clients like that. But, in a general sense, I would think anybody who's thinking of making that huge decision like that, that's going to change their whole life, they should see a professional just to make sure they're doing it for the right reasons.
Exactly. And that is true. And it used to be mandated. I think they had to have either so many sessions or I think like 1 to 2 years of seeing a mental health professional before they could start the process of at least having the surgery
Hmm.
from a plastic surgery standpoint. All right, bet. What are some of the like primary causes of mental illness, or not even mental illness, but just like having these mental breakdowns? Would you say?
Lack of coping skills,
Okay.
lack of social support, and not understanding your emotions or being able to identify it. I think those
Hmm.
are the key aspects of why people go through what they go through and have these mental breakdowns.
Gotcha. Gotcha. And then what are 3 things people can do, to help with anxiety or even depression? Or if they're kinda like the same thing in terms of, like, coping mechanisms or skills?
Let's start with anxiety. So anxiety is the fear of. So one
Yeah,
thing about a lot of people is that they're always thinking about one or two things. It's either the past or the future. Guess what they're not thinking about?
right now.
The present.
Yeah.
Exactly. So doing things like meditation, that definitely helps, just setting immediate goals or short-term goals,
Right.
those things help. But I think that when you start thinking about the what ifs, because when you think about the future, you think about the what ifs, you think about the past, you think about something that you can't change.
Mhm.
Those things get you into a lot of trouble, and that
Right.
to the point where now it feels overwhelming.
Right. Gotcha, gotcha. Oh, man. All right, well, man, that was it. That was the Tricky Tricks trivia. It wasn't too bad, was it?
Not at all.
No, man. It's just a couple of questions, try to integrate plastic surgery I would say like most of my viewers are, people interested in plastic surgery
Okay.
or, something like that. So I try to, feed them a little bit.
Hmm.
So, man, we're going to, kind of dive into like some more of your work. We were talking off camera about some of the like performance coaching you're doing. So, can you just tell us a little bit about that? Like, when people think of like therapy, at least a layperson like me, I'm thinking about you laying on the couch. I'm telling you how my day went, how I'm pissed off at work and, dealing with all this trauma and stuff like that from my day to day. But like, this seems, I don't know if it's unconventional, but it seems unconventional because I know you're creating your own lane.
Hmm.
So can you expand on like some of the things that you do that people might not even consider therapy or part of like the quote unquote therapist situation or session?
So one thing about I know about working with celebrities is that people have this idea that they have it all together when it
Right.
comes to public appearances,
Right.
and that's just something that you may see from the outside looking in, but inside looking out, which is because I'm working with the inside.
Yeah.
There, a lot of them are struggling with that. So what I do on a regular is that you'll see me at a football game, you'll see me at a award show. I'm prepping my clients to maybe read a teleprompter.
Hmm.
Because I use an example. If you ever see Mayweather read a teleprompter, he's stuttering.
Yeah.
It's very hard for him. Mind, this is Money Mayweather.
Yeah.
He's always in the public eye.
Yeah.
But when it comes to those type of aspects, he struggles because he has a level of anxiety.
Right.
So I help people like that calm themselves and
Yeah.
just be the best version of themselves when they need to be.
And the crazy part is, people try to run with that and say, "Oh, he can't read or he can't
You
do
can
this and
definitely
that."
read.
Yeah, I mean, you don't get where you are. You know what I'm
Hmm.
saying? Like, being able to like sign these multi-million-dollar
You're
contracts
me.
without being able to see, what's going on. So, I think that's honorable that you put that out there because, like, people try to run and like make jokes and stuff like that. Like, hey, man, you try to go up there knowing millions of people are about
Yeah.
to be like in your face dissecting every word you're about to say and see how you do.
Especially if you're hated, like
Right.
Mayweather
Exactly. Yeah,
is.
exactly. Especially you got a like a
um,
persona.
mhm.
What are some things that you could like tell our viewers or even myself, man, that like create a better work-life balance or a new term that I heard yesterday was work-life integration because it's always hard to like have a 50-50 balance.
Ooh, it's a good one. I would say you have to look at it as like a pie.
Yeah.
In that pie, there's different divisions of a pie.
Yeah.
There's career, there's family, there's relationships, and of course there's self.
Hmm.
You have to realize in that pie, everything has to be equal out. People tend to neglect self. That's the first thing they neglect is
Right.
self. Second thing is relationship, and then family, and of course, and then career is the last one because career everybody needs to provide.
Right.
Everybody likes making money, so that's usually the first one they put the most of the focus.
Right.
So I think that if you're trying to be the best version of yourself, you have to understand that you have to be able to balance your life as much as possible. Because if not, you could be the best professional, whatever
Mhm.
field that you're in, but you see this is why you see a lot of people committing suicide now.
Yeah. Yeah.
How many CEOs you see in the last 5 years committed suicide?
Yeah, it's a lot.
Or a lot. Why? And people may think CEO, a multi-billion dollar company. Why would someone like that commit suicide? He has
Yeah.
everything in the world.
Hmm.
Why? Because he neglected self and everything and other priorities to the point where now he feels like life doesn't matter. You got to get your priorities straight. I don't care what you're doing in life. You may think, oh, I don't make enough money. it will come.
Yeah.
But you have to act like I always say to other patients, you have to do it for the right reasons. Are you working? Are you doing the job that you do for the right reasons, or are you just doing it to get a paycheck?
Right.
Are you in a relationship because you want to be in a relationship, or because you're just doing because you're lonely?
Yeah.
Do things for the right reason is going to guide you on the right path. Do it for the wrong reasons, and you're going to find yourself in my office.
Yeah, having a breakdown.
Yes,
for sure. But no, man, that's a very good like observation. Especially like I know at least in the medical field, like some people are going through like extreme burnout because they've worked so hard to like get through these classes, and then try to rise up within their career, see so many patients, and they just like they don't prioritize themselves. They prioritize their patients and their job, sometimes their family, and then next thing you know, they either committing suicide or they have this mental breakdown and they don't know and they like are in this like very like stringent like rehab or therapy sessions trying to get back themselves because they've neglected themselves for
yeah.
years, like severely neglected, whether that's diet and mental health and like from a physical
I
standpoint
always
too.
say that the more successful you become, the more people want stuff from you.
Yeah.
And you have to stop saying yes and start saying no.
Right.
And I think that people have a hard time saying no. And it sounds so easy, but people have a hard time when it comes to family, friends, people that you grew up with, people that you just met. Because you want to be the nice guy, you want to be loved by people. And I would say you don't need to be loved by everybody.
Right.
Be loved by the people that you want to be loved by, that small circle of yours, and let that be that.
Right.
There's gonna be people who love you and hate you, but they'll let that dictate who you are as a person and allow you to neglect who you need to be as to be the best version of yourself.
Right, man. Hey, very well put. And in your perspective, have wellness and healthiness like become a trend? Because to me, it seems
Mhm.
like a lot more people are talking about their health. A lot of more people are talking about like their mental health and just being healthy and fit in
Yeah.
this day and age. More so because it just seems like the social media trend. So is that something you've observed, or do you feel like it's kind of like stagnant? And I know your thing is skewed because you're actually looking at
Yeah.
these things per se.
I think that's another reason why I'm motivated to work with the type of clients that I work with. Because I would say that's like me reverse engineering saving the world by saving the people that the world looks up to. So if I help a person like a LeBron James with mental health, and he goes start putting on a post, I love mental health. Y'all should
Yeah.
check it out.
Right.
While I can only save one person, he saves 20 million people.
Right.
That's me changing the field from a very distant way, but I'm still involved in the process.
Gotcha. No.
So changes you have to make change in your own way.
Yeah. The man said, I got the plan. I know how I'm gonna do
Oh
this.
yeah.
Like, oh man, that's dope. If you weren't the therapist, what do you think you'd be doing right now? Outside of hooping.
Oh yeah. Well, yes. I'm
Outside of
about to say I'm about to go hoop.
Yeah.
You know what? I ain't gonna lie to you. I have no idea.
Mm.
Because I'll probably look for the first thing that makes me money.
Yeah.
Because like I said, as a young inner city black kid, that's what we
Yeah,
care about.
yeah,
Just
exactly.
what is gonna make us money?
Right.
Whether it be rapping, producing,
Right.
playing ball.
Mhm.
So like I said, being a doctor was never in the cards for me.
Right.
So I fell into it. Once I fell into it, I received it and I loved it. But
Right.
trust me, I never thought. I don't. My mom would tell you every day. You thought this man would be a doctor? You crazy as hell. But
I know they're super proud too.
Oh yeah,
boy.
most definitely. Because you know what? It took them a while to accept that I was a mental health doctor,
Mhm.
right?
Oh yeah, because of the culture.
Yes. He's like, because she was like, oh no, he's an MD. No, no, mom, I'm an MD.
Yeah,
That's not, PhD over
Right.
here.
Mhm.
But so it took her a while. But now that she sees that how much I'm able to make the change within the culture,
Right.
especially with the Haitian culture, she loves it now.
So, like during that time, and that also stresses like when you were in graduate school getting your PhD.
Mhm.
Saying was she proud at the point that like you were getting a PhD, but still didn't really understand, or did they even make it even a little bit more stressful because your parents didn't really understand the struggle you were going through? Not necessarily a struggle, but going through the process, this hard process of getting your training.
I think when I was going for my bachelor's, they questioned everything.
Okay.
Because they like, well, yo, what the hell are you doing right now?
Right,
You feel
right.
me? There's so many other fields that could pay more.
Why you not an engineer? Why you not going to med
That's
school?
what
Yeah,
they look at the money.
Yeah.
You feel me? But once he started going for the masters, then the doctor said, you know what? Despite what I may think, I love the fact that he's going the extra mile.
Right.
Because he was not supposed to be here.
Right.
I never saw him to be here. I saw him being successful. I just didn't know what that would look like.
Mm-hmm.
So the fact that she saw me putting the work in, and pushing through, there were hard days.
Right.
Any doctor would tell you that
Yeah.
there were some hard days. You had to study. You had to make the
Exactly.
sacrifices. So she saw that and she said, you know what? I may not understand this field that you're in, but I love that you went above and beyond to go get it.
Wow, that's dope, man. And so I know you have a nonprofit. I know you've worked with nonprofits. Can you tell us a little bit about your own nonprofit?
Yeah, so it's called Rocker Community Health. So I'm in the community, of course, finding more relatable ways to connect with my community, right? So
Mhm.
hip hop therapy is one of those things, and also just having a lot of minority professionals to educate the community about different
Mhm.
stuff, whether it be mental health or physical health within the
Okay.
community.
Okay. And how long you been doing that?
Doing it for 6 years now.
Okay, so you've been up and going for a minute.
Oh yeah,
That's
yeah.
dope.
Overall, I've been doing therapy for 13 years. So,
Okay.
but things started changing in the last 6 years.
Okay, awesome, awesome. And I know we were talking off camera, and we were talking about um, almost like it almost seems like a new venture that you're working on trying to get more Black men, especially those in the medical field and in health, together to try to like almost like fellowship to some degree. What's some of your thoughts on that?
When I think about that, I think about how I was as a child, 16 years old.
Yeah.
It was cool to be a rapper. It was
Hmm.
cool to be a producer. It was cool to be an athlete. It was not cool to be a doctor
That's true.
because in our society, doctors don't promote this stuff having fun.
Right.
You'll see them in the hospital. You see them with lab coats. You see them just doing things, professional gatherings, the professional, conferences, but never turn up in the club, popping
Right.
bottles, traveling as men and sharing how they're feeling and the stuff that they're going through.
Right.
So I think as now as Black men or just the Black culture, as professionals, we need to do more of that to show society that yes, we could be professionals
Yep.
and we can still have a lot of fun doing it.
Hey man, I love that sound. So we definitely got to make that happen
Oh, most
ASAP.
definitely.
ASAP. I also got to bring you on and talk to Cliff Addison, who's the founder of Urban Golf. Man, I
Okay.
think you would hit it off, man. You're definitely someone that we got to plug you in, and of what you got going on, and expanding our brand at the same time too. But Jeff, man, I appreciate you being here,
Thanks for
man.
having me, bro.
Welcome to Triggs Table
All
Talk. Is
right.
there anything I can do for you? Let me know. Of course, we gonna make some things
Oh,
shake
most
off
definitely.
off camera. But like, if people wanted to get in touch with you, whether that's to learn more about you or learn more about your organizations that you represent, or even try to become a client, how can they reach out to you and get something on the books?
So the first thing you could do is that you could go to Google search Dr. Jeff Rocker near me because I'm licensed in 25 states, so I have practice in all 25 states. What they are, I can't name all of them right now, but if you Google it, trust me,
just
something
know
will pop
he's
up.
certified in 25 states,
Yes.
like half the country.
Or you can go to my website, which is axjeffrocker.com, or find me on Instagram at axjeff.
Yeah. See, there you go. So, with that being said, thank you, Dr. Jeff. You guys click like, subscribe. Remember, like, if you want to see dope content like this, let us know. If you're interested in trying to reach out to Dr. Jeff, of course, he just gave us information. We're gonna drop it below. Give us your comments, give us your feedback. At the end of the day, I still am a plastic surgeon. I have some great specials going on. Click like and subscribe. You can follow me at Vixen Plastic Surgery, at Dr. Triggs Miami, at W Triggs MD for some of those specials. In terms of plastic surgery, remember that your consultation is completely free, and we can go from there. So, with that being said, you guys have a great evening, and I'll see you next time on Triggs Table Talks.